I want to talk a little bit about what happens as you've gotten weeks or months, maybe even years after a car crash. It's normal for a lot of people to have a variety of injuries, a variety of symptoms from a particular crash. Maybe there's back pain, maybe there's neck pain, maybe there's headaches, light sensitivity, and things like that. And over time, some of those symptoms will eventually resolve. Some are more acute, they last the days or weeks after a crash, and then others sort of linger and then get better, and then some still never really get better. And so, what do you do with that? So, some symptoms never do go away and actually reach a point like we call it a plateau or end of healing. And sometimes there just isn't anything that the medical profession can do for that other than helping to manage those symptoms, reduce the things that cause flare ups and aggravate them, pain management, things such as injections and stuff like that. But it's really important when you're seeing your doctor um, to let them know all the different things that are still going on. Maybe your back pain is better since the last time, but the neck pain is still there, or vice versa. It's really important when you see your providers to let them know what are all the different symptoms you're still dealing with, not just the worst ones, not just the ones that you're there for treatment for, but all of them, and so that they can make a note of that in the medical records. At some point, and sometimes you may have to advocate for yourself to your doctors, is it's time to see specialists. Maybe have more advanced testing done, such as MRIs. A lot of doctors will order X-rays for things to make sure that there's no broken bones, but X-rays are limited in what they can see besides broken bones. Things like nerve damage, soft tissue damage, more less obvious injuries may not show up on an X-ray and may not even show up on an MRI or CT scan, but sometimes they do. And you have to sort of advocate for yourself and ask your doctors to order that, especially as symptoms continue to go on. Make sure there isn't some underlying problem, especially with the back. Maybe there's a disc that is herniated, or maybe there's a torn tendon, torn structure in your knee or your arm, things like that. And ask them to refer you to specialists. So if you're generally seeing a primary care physician, but your knee is really bothering you, you may need to ask them to give you a referral to an orthopedic surgeon. Or if you're having back and neck or like pain and tingling in your arms, you may need to request a consult with a neurosurgeon or a neurologist of some sort. So it's really important that you're letting your doctors know what's going on, what symptoms have gotten better, which ones are still persisting, so that they can try to do something about it. And if they can't do something about it, they can make a note of that in the medical records. So then you have that when it comes time to present a claim to the insurance company. You can show you've sort of attempted to get all reasonable medical care that's available for particular injuries, and sometimes there just isn't anything they can do for you, and then that can be shown to the insurance company and submitted when eventually a demand is made.